Hi, everyone. For those of you who have joined us, welcome. We're just going to wait for a minute or two for others to join, and then we'll get started with the talk. Thanks. All right. Well, hello, everyone. Thanks to all of you for joining us today, and welcome to the Alumni Reunion Week officially. My name is Gilbert Kusari, and I am the Director of Advancement at the Bloomberg Faculty of Nursing. We're thrilled to welcome you here today and to kick off officially for Faculty of Nursing, our Alumni Reunion Week activities. Before we begin, we wish to acknowledge this land on which the University of Toronto operates for thousands of years. This land has been the traditional land of the Huron-Wendat, the Senecas, and the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous peoples from across Turtle Island, and we are grateful to have the opportunity to work on this land. We invite you to take a moment to reflect on the land where you are as you're joining us today. And if you're not familiar with that, please visit the link that we just posted on the chat box, nativeland.ca, to find out more information on the topic. As we have seen from past years, the lectures offered during the Alumni Reunion Week continue to provide a great opportunity for alumni across the board to learn from leading scholars and professors on important and current topics, and that without the stress of the homework attached to it. So today, our topic is of particular significance as it addresses mental health and wellness for our students, a subject that was and continues to be a top priority, both at the Faculty of Nursing and across the university. We're thrilled today to have Professor Kristin Cleverley with us, and she will speak about InLight, the University Student and Youth Mental Health Initiative. Following the lecture, we welcome and encourage you to ask questions. You can do so by posting your questions in the Q&A feature located on the right-hand side of your screen. And now I'd just like to say a few words about Professor Cleverley. Professor Cleverley is the CAMH Chair in Mental Health Nursing Research. She's an Associate Professor in the Lawrence S. Bloomberg Faculty of Nursing and Department of Psychiatry, and the Academic Director of the Student Mental Health Research Initiative at the University of Toronto. She is also a Senior Scientist in the Margaret and Wallace McCain Center for Child, Youth, and Family Mental Health at the Center for Addiction and Mental Health, otherwise known as CAMH. Dr. Cleverley is an expert in youth and student mental health, patient-oriented research, and mental health care transitions, meeting regularly with programs and hospital administrators to advise on opportunities to strengthen transition standards and protocols. Her current research engages students, youth, and caregivers as experts in informing and co-designing novel clinical and health system interventions to improve mental health care transitions for youth with mental illness and substance use. Please join me in welcoming Professor Cleverley.
Hello, everyone. It's always wonderful to see the names of many current and former colleagues. So hello to those individuals. As Ibarra mentioned, please feel free to post Q&As. We'll spend time at the end going through them. Just as a note, I can't dispense clinical advice through a webinar. So if you had clinical questions, there will be resources that we will be posting as I go through. I also wanted to mention that one of my staff, Gloria Rebello, who's an incredible support, will be posting a lot of resources as I move through the slides in the chat box. So if you're not catching things as I'm saying, please note that those will be available in the chat box, so you can just open the screens. So with that, today I just really wanted to provide a brief background on a very brief background on where we're at with post-secondary student mental health. More specifically at U of T and here in Ontario, an introduction to INLIGHT, which is a new strategic initiative or research center here at the University of Toronto focused on student mental health research, and highlight the effort that INLIGHT has made on student engagement and co-design, and as well as supporting the clinical redesign of mental health services for students here at the University of Toronto. So despite a lot of efforts, including both from the administration at colleges and universities, as well as from student services staff themselves, we are to innovate and improve mental health services and programs for students. We do know that mental illness, or at least reported mental illness and reported distress, is increasing. And we have a lot of data, quite robust data, to show that demand for services is steeply rising. We know that at U of T, that the request for counseling and psychiatric services is going up 30% year over year, including through the pandemic. And we also have data to show, especially at U of T, that the use of emergency services by students in distress is a growing trend across post-secondary schools, and again, including U of T. We do know this was also exacerbated by the ongoing COVID-19 pandemic. Simultaneously, there's been increasing, I said it nicely here, public interest, but I would say advocacy and demand to address this problem. And there's been an onset and growth of post-secondary student mental health organizations. Many would be familiar with jack.org. There are others, national campaigns, including the Mental Health Commission of Canada and Bell Let's Talk. And then in Ontario, we have a really active provincial association called the Centre for Innovation in Campus Mental Health. So we know there's increasing reported rates of distress, increased demand for services, and then this demand from students and the public for better access to services and to address the problem. This is not new. Over the last couple of years, this is an article in the CBC from 2019 that really drew attention to a number of student deaths at the University of Toronto. And then this was before the pandemic, and then during the pandemic, they used the same picture I noted, but a new article that really talked about the University of Toronto developing a task force, which I'll talk about, and this was in 2020. And then Maclean's wrote an article this past fall that looked at this, what they called a mental health crisis at Canadian universities. So there's been this increased demand, and then also media attention on this, what they're again calling a mental health crisis. So what did U of T do? So U of T, President Girdler, who's our current president, wrote a letter to the campus community in 2019 after we did have a number of student deaths, saying that I'm going to develop a presidential and provincial task force to identify what we can do to address this problem. The presidential task force worked very hard and did a number of engagement sessions and tabled a report in 2019, which Gloria will be linking to in the chat box. And then there was administrative response in January 2020. And again, just thinking about the timeline of that happened right before the pandemic really caused a lot of public health restrictions. But one of the key outputs of that report was that there was a gap in research related to student mental health, that we really lacked knowledge, evidence-based to make decisions, informed decisions about how to respond and react to the demands of the needs of students. And this isn't unique to U of T. There's actually a critical gap in research and student mental health research around the world. I would say that this is surprising to most because it's a topic that's been making a lot of headlines over the last number of years. And we are also talking about a topic that is situated within our academic and research enterprises, the post-secondary institution. There's just really been a disconnect between the research piece and the demand for the information or the knowledge. And so U of T really wanted to think about how do we invest to spark innovative, bold, research-driven solutions. They felt strongly, U of T, that this isn't just a U of T responsibility, but U of T can lead on this given the resources and the expertise that we have. And that student mental health is a shared campus responsibility. And it shouldn't just be of the president or the provost or student health services, that really we need to think about how can interdisciplinary groups come together to drive research solutions. And so we were poised, myself and a team of researchers, with positioning U of T as a global leader in student mental health research. So myself and my engagement lead, Emma McCann, started on started down the road of gathering information and doing outreach to a number of collaborators and groups that were invested and had knowledge in this topic to develop a strategic plan to support a student mental health research initiative at U of T. So through 2020 and 2021, we engaged experts from across the University of Toronto, including 9 academic units, other leaders from the academic, student, the diversity and the clinical lens. We established partnerships with universities that were doing this research around the world. We developed a student advisory committee to support our work and to understand what the needs of the students were. And from that advisory committee, we were able to identify what the needs of students specifically were, but also how students can be part of the InLight or the research response. And I'll get into that in a little bit more. But after this year-long engagement process, InLight, which was named by students, and I should say also all of the branding and the imagery you're going to see in this presentation was also developed and designed by our student advisory committee. So in 2021, 2022, actually, InLight was formed. Our vision that again was written with students was to enhance student mental health and wellness for all students through research, innovations, and applications in collaboration with students, institutions, and our community partners. And our mission was to improve student mental health and wellness outcomes by investing in high quality, impactful research and driving scalable research innovations. So InLight officially soft launched last fall, so fall 2022, but actually had our official launch just earlier this month. And InLight is a research center that builds and supports innovations in student mental health. We have 4 priority areas. The first is to build research and innovation infrastructure. So that's to support research. Our second is to drive authentic engagement in research. Our third is to generate foundational knowledge and research-driven innovations. And then our fourth is to connect people, ideas, and research. And I'll talk a little bit how we're doing that shortly. We also developed foundational principles that guided all of our work at InLight. The selection and the description of these principles were led by our student advisory committee. And these were our what I call guiding lights. And we frequently return to these principles to ensure we're staying true to our commitment to the University of Toronto community and specifically as students. And it is not a mistake that students as collaborators is our most important and our top guiding principle, although there are a number. As I mentioned, we have 4 priority areas, and we have deliverables and activities that are happening within each of those 4 areas. Within the infrastructure, I'm going to talk about how Inlight is supporting the evaluation and the research of our new mental health clinical services and our redesign. We're developing with students student-driven training modules to support students to engage in mental health research, to know how and where and when they can engage, but also so that faculty and researchers can understand how to engage students in co-design of research. We're also and have developed a student engagement model, which our student advisory committee is just in the process of writing up. In terms of innovations, we actually have 3 research grant programs and 2 research fellowship programs, which you can find on our website. So we've supported 13 research grants across divisions at the University of Toronto, and 7 research fellowships at the undergraduate level, so for master's and PhD research students, and 4 undergraduate studentships. In terms of knowledge mobilization, over the past year, we've run a global speaker series with our international university partners, which has had hundreds and hundreds of attendees from around the world. And this is to really, these global speaker series have been about critical or pivotal topics related to student mental health and how research can support informing that. And Gloria will, these are all recorded and on our website, and Gloria will have linked where you can access that in the chat. And we're just about to run our first annual research symposium with students, faculty, and staff from around the world. So what we hope to do with Inlight, with this student mental health research initiative, is to develop a robust talent pipeline leading to the next generation of mental health researchers. I think this is one of the ways that we'll be able to fill this critical research gap. We don't have a lot of researchers in Canada, let alone at the University of Toronto, whose area of research focuses on the post-secondary student mental health population relative to, for example, to child and youth psychiatry. We are really, really under-researched. So we're hoping to, through the fellowship program, to really develop and invest in students that will become our next generation of researchers. As I mentioned, we're developing a novel and have developed a novel model of student engagement. This really supports, again, researchers and faculties in understanding how best to engage students. We're working really closely with a number of divisions across the University of Toronto, as well as outside the university, to develop policies, interventions, programs, and best practices within post-secondary student mental health. We are partnering extensively both with our community hospitals, organizations, as well as international organizations. This is not a unique issue to Canada or certainly not the University of Toronto. And then we're funding research to spark innovation in this area. Through our strategic planning process, we develop thematic research areas. I won't get into detail on them, but they're really foundational. They're foundational to our knowledge and understanding of how we can support post-secondary students with their mental health and well-being. And right now I'm going to talk about 2 of these areas. One is about student engagement, and the other is about acute care pathways for students requiring more specialized mental health services from our hospital partners. So meaningful student engagement has been critical to Inlight at every step of the process, as well as through our knowledge mobilization. So including today, you'll see there's aspects of students' input and student engagement that's been built through the presentation. For us, student engagement is meaningful and timely involvement as students as experts in the process on decisions that will affect them. So as students with their own lived experience, so we in our, for example, our adjudication panels or committees for all of our research grants and our fellowships, we have student adjudicators that are considered equal contributing members. So our most recent research adjudication panel had equal number of student adjudicators as faculty or researcher adjudicators. To me, that's novel, even across CIHR and SSHRC. and it went really well. So really ensuring that students' voice is equal. So what are the benefits of engaging students in co-design, specifically of a large research program and also within this topic area of student mental health? The benefits to students are, and this is, again, these slides were created by our student advisory committee, is it fosters a greater sense of belonging, personal and professional growth, and it enhances self-awareness and appreciation for the experiences of others. Where we benefit at Inlight to having a very, very knowledgeable student engagement lead who works with student engagement facilitators and our student engagement team to ensure that students, it's not just tokenistic, that students are truly feeling like they belong as part of this process, and that it's an opportunity or an outlet for them to engage in, advocacy about items and things that relate to them. The benefits to researchers are that it increases the quality and the impact of the research they do. It enhances effectiveness of the interventions and the programs, and we've certainly seen that in the acute navigation pathway I'm going to talk about, and it strengthens the visibility of the research. Importantly is the benefit to our campus communities. Co-design can improve the success of policies and programs. It increases the transparency and builds mutual understanding, particularly when we are developing a new intervention or we're implementing new policies at the university that relate to student mental health. And it promotes a culture of inclusion. I often remind individuals in meetings that the reason we are working at a university is because of students, first and foremost. Forward. And this is a quote from, we recently in the nursing, the faculty of nursing at U of T, we have an annual research report, and there was an article or a write-up on this initiative, and Gloria will put in the chat this article. But one of the nursing PhD students said, it's a part of our global student advisory committee as part of our international partnership, said that as an international student, I have a unique perspective on the importance of accessible mental health services, and I understand the challenge that myself and my peers faced through the COVID-19 pandemic. Being able to share this knowledge to develop a shared language and resources around mental health for students is monumentous. So in my experience, I've found that what students are contributing is as meaningful, if not more meaningful, because it's firsthand than what we found with other groups of contributors or collaborators. So this is just one example of it. And Rosina happens to be a nurse and a PhD student, but in the article, you'll see other examples of the impact that it's had. I did want to note that we do have a very robust student advisory committee. And one of the things that we prioritize is that we have tri-campus, so all three of the University of Toronto campuses, a multi-divisional perspective, as well as we have equal weighting across the undergraduate and the graduate programs, as well as we have a high proportion of international students on our advisory panels. So the current student advisory committee has three priorities for this term. These were identified by the students, and they aim to strengthen Inlight's student engagement mandate. So they support the development and implementation of the grants and fellowship programs, as I noted. They have supported the development and will continue of our diversity or our equity, diversity, inclusion, accessibility, and ingenuity action plan, and ensuring that these principles are embedded across Inlight. They support the engagement and development of a broad student network, ensuring U of T students are represented across Inlight's activities. And they have been co-designing the student mental health research engagement model, which has been supported by, they've been helping us complete reviews of the literature. So I just want to highlight one of the major initiatives that Inlight has been supporting over the past year and will continue as we move forward. And that's a new, and it's quite an innovative pathway from the university to our acute care partner, the Center for Addiction and Mental Health here in Toronto. So about a year and a half ago, the University of Toronto officially partnered with CAMH to overhaul our mental health services for students. I should say that U of T's always been partnered with CAMH. They're one of our academic health science centers, but we've been partnered with them both in research partnerships and in student placement and learner partnerships. But we have not partnered with them until this partnership with regard to providing mental health services for our students. Just to let everyone know, on average, 10 U of T students per week visit the CAMH emergency department. This was actually, and we've been collecting data now since last September, so September 2022. This was much higher than CAMH had anticipated. They're like, yeah, we see students. And it was a lot higher than the University of Toronto knew, because up until this past September, University of Toronto had no way of identifying where its students were accessing mental health, acute mental health services, so emergency room. So in total, we've had 370 University of Toronto students access the emergency room at CAMH since last September. And of those, 40% are presenting with anxiety and or depression, and almost 40% with acute suicidal ideation. So the reasons for individuals visiting the emergency room are not surprising to CAMH, because that's what we do. We are a psychiatric emergency room. I think what was a little bit surprising to, again, both centers was just the volume, the number of students. Of the 370, sorry, I do have a cold right now, about 20% are admitted to the inpatient unit, and the others are discharged from the emerge. So what University of Toronto and CAMH decided in response to that task force was decided to launch a new acute service or navigation pathway between the University of Toronto and CAMH. And what this partnership aims to address is the higher acuity, complex care end of students' mental health needs at the University of Toronto. So I didn't go into it here, but Gloria has linked the mental health support page that University of Toronto has. We have very robust same-day access service, as well as psychiatric care for students across the university. But what we were missing was access to the complex acute emergent care. So what this pathway that launched with CAMH in September 2020 is University of Toronto funded 2 full-time clinical navigators. They are masters of social work practitioners with community and acute care mental health service expertise. They get referrals for University of Toronto students through both the CAMH emergency room. We have a youth urgent care program, as well as if a student makes it to the emergency room, or sorry, to the inpatient unit through direct admission. Very rare, but it can happen. So the majority of the referrals are coming through CAMH emergency room. We also have a cross-appointed psychiatrist between the University of Toronto and CAMH that supports the communication, as well as they have the expertise in what the services and programs the university offers, so that the navigators know whom to connect with at the university should they need to with regard to navigation or the transition planning. The University of Toronto navigation navigators work very closely with the health center at U of T, our crisis teams. It's called the SCRAP team at U of T, as well as our community partners. And then in Light, our role is we're leading the research and the evaluation of this entire collaboration and initiative. So what does the pathway look like? Any student, University of Toronto student, who presents to any of these programs or services, this is pretty much any program or service at U of T, so emergency room, our bridging clinic, our inpatient, and then also they can receive consultations directly from health and wellness at University of Toronto. We'll get a referral to navigation. It's important to know that students can refuse the referral, and there is some times where it may get missed or not offered. So when there's a clinician in the emergency room, maybe the student is only in for a short time and a referral doesn't get made. But in essence, the referral gets made, the navigator sees the student, and the student gets consented into this. It's a clinical intervention that is housed at CAMH. They then start on measurement-based care. So there's an intake assessment that the navigators do that has a number of mood, anxiety, health service utilization assessments. And the navigator then makes the decision about what the plan of care can be. It's also important to know, like most navigation programs, the navigators, the student can remove consent or refuse access to the service at any time. Or the navigator might say they're very well connected already to a program or a service. We've touched base with them, but they can get immediately discharged if they already have appropriate services. The model looks similar to this. They're identified, the navigator connects with them and discusses what a navigator is, what the program is, and what the student can expect to receive. They have an initial, once they accept or consent into this clinical intervention, they have an initial appointment where they do an intake assessment and a number of the baseline psychiatric and health service assessments. The navigator then liaises with the CAMH clinical team, and then any identified caregiver or family, broadly defined family. It could be a peer, the supports that the student identifies and the navigator has consent to connect with. The navigator then develops a plan of care, confirms the level of need and the options for receiving service. And the navigator works, this is really critical, works as a liaison between the CAMH clinical team and whatever service that the student will be transitioning to. And they work, if needed, with the crisis management team, including interim resources, especially when high risk, whether it be risk to self or others, are identified and there's a need for resources. Once the student is discharged from CAMH or from navigation, they do continue to liaise with the student until they've fully connected with the next service or program. And it's a closed loop system to make sure that the student gets to where they need to get. Inlight's role is that we've developed and co-designed the measurement-based care. So we've actually integrated into the electronic health record at CAMH the ability to identify the University of Toronto students, the referral pathway, and then both process and outcome measures. We also developed and wrote a successful CIHR Teams grant to robustly evaluate from a research standpoint how navigation or how this new pathway supports the University of Toronto students through the transition from CAMH back to either U of T or their community service. And it's important to know that we're doing both a quantitative and a qualitative evaluation. The qualitative piece is really important to know what's working and what's not from the perspective of both the students, but also clinicians across CAMH and the University of Toronto. So that's I figured we'd have enough time for a robust discussion. That's the completion of the formal presentation, but I always get asked, how can you learn more? So, and Gloria will link this in the chat. Inlight has a very robust network, so please feel free to join that. We send out monthly updates. And on this website, you'll also find access to our global speaker series. And there's been some really interesting talks that have come from this global speaker series, including one that is always of interest to people on non-suicidal self-injury among students, and then other things like embedding mental health into the classroom. And I should say, these are all the videos, the recorded videos are all available on the website. As I mentioned, U of T also has a very robust website for both students, but also faculty and staff can also use it to find resources to wayfind on within the university, but it also wayfinds or supports transitions to services outside of U of T if needed. And then the last thing I'll mention is that there was the task force report, the Presidential and Provostial Task Force, and the university's been really good at updating the University of Toronto community on where they're at with responding. There was 31 recommendations, and they've grouped the recommendations into 5 themes. We fall under, Inlight falls under 4 of the 5 themes, so just not physical spaces, although we fund research through Inlight that deals with physical spaces. But if you click on any of these, you'll see that U of T is being really transparent about where it's at with each of the items. A priority for the student mental health redesign was same day drop-in counseling, and you can see that that's been completed, and then you'll see the connection with CAMH there as well. But they're updating this constantly, so it's a good place, especially for faculty and staff, including those that are connected to the Faculty of Nursing, to connect back to see where are we at with a lot of those priorities. So now I'm going to open it up to Q&As. I'm going to stop sharing. The one thing about Zoom webinar is I can't see people, but you can post in the bottom in the Q&A box if you have any questions. I know I've thrown a lot of resources at everyone, so it could be that there aren't specific questions, which is okay. My contact information I can link, and then feel free to connect with me after. And I see some, I'm just looking at the attendee list, which was wonderful. I see a number again of current and past peers and colleagues. No questions. Which has been happening recently. I said to my lab recently that there's a lot of Zoom fatigue, that people are tuning in, but it's not the same engagement. I should have planted questions with one of my PhD students that's on. Yeah, that's a good question, Pamela. So the question is, can you talk a bit about connecting with students globally for input? So, and Gloria posted the link to our global research network, but we've connected specifically with 4 universities: National Taiwan University, the University of Sydney in Australia, and King's College London in England. And through that, we developed a global student working group with 12 students, 16 students, sorry, 4 from each campus, because we have to include U of T. And they helped us do a couple of things. One is we've just finished a international or global consensus on what the global priorities are in student mental health research. Things like addressing access to mental health services, research on loneliness and understanding what is impacting and how we can deal with the loneliness pandemic that students are experiencing. Those bubbled up, and we presented on those in last week actually, in the Global Speaker Series. They're also supporting a global student model of engagement. How do we engage students internationally? So they helped us with reach outs for that global consensus. So we had students and faculty and staff engaging in that global consensus from outside of the 4 partner universities. The other thing they're helping us with is language and understanding how even the definition of mental health and mental illness isn't just what we think it is at U of T or in Toronto. And that's important because while we can work with our U of T students, we have international students coming to U of T in an increasing amount. So working with an international student advisory helps us with ensuring that we're on top of terms, the different cultural aspects of mental health. Marilyn, I wonder if that's Marilyn Valentine. If it is, hello. Is your Navigator program in downtown campus only or for U of T and UTS? Yeah, that's a really good question. So we certainly have UTM and UTSC students accessing it. So anybody going to U of T. We are in the process of developing a partnership between Scarborough Health System and UTSC, and the same with Trillium Health Partners and UTM, although we're doing a phased. That being said, any student, and we have had a high proportion of students from our UTM or UTSC campus accessing CAMH. So they are able to access it, but then we're developing those connections at the other campuses as well. Gordon, do you think the U of T initiative will dilute the availability of clinicians for the general public? No, they are what we in clinical operations we talk about supernumerary, so they are added on top of. They do not take away, and in fact, our research, I believe, will show, I would hypothesize, because I've developed other navigation programs for youth at Sick Kids, worked with Michael Guerin, North York General, and then also have worked with Michael Guerin Hospital. It actually alleviates other clinical services because it's an added individual who has specialization in that area. So it frees up other clinical services. So I hope that helps answer your question. It certainly does not take away. I would say it actually alleviates the frontline or point of care staff. Hi, Mary. Hi, Kristin. Thanks for sharing your work. Would you share a little bit about how you recruit and engage the student leads of your research? Yeah, so I would say students are really active in this area, but we work with our current student advisory committee in what we call a tongue and spoke model, like that reach out. Initially, we connected with 50 student organizations across the University of Toronto, both official, so clubs, and then also not official, to advertise our student advisory committee applications. We also put it out on various social media channels, and then sent it out through the divisions. So the divisions are like the Faculty of Nursing, to say that we had a call. I think one of our reflections is, how do we get to students who may not necessarily put their hand up to get involved? And then the other one is certain groups of students that we are seeing aren't applying. So we have low engagement from our Indigenous students across the university. So working more specifically with clubs and student programs that work specifically with those student groups. But again, we put out a call for student advisory committees and had a very diverse group of hundreds of students apply. Now, that doesn't seem like a lot proportionately when we have 100,000 students at U of T, but we also do, again, that tongue and spoke, where while we only have 10 official students on our student advisory committee, when specific projects or research projects come up, we then engage students broader outside of our student advisory committee. Chris asked, how is the flow care with a navigator a different experience for the students? Yeah, so it's a specific point of contact for the students that understands the university culture and environment. I should note that the students have the right to not consent to have the university involved in their care. And there's a variety of reasons why that might happen. We're learning culturally, some students want to separate rightfully so, want to separate the academic from the clinical aspect. There's a known and I think a valid fear that if the university academic side knows about their mental health needs, it might interfere. Although the university is working really hard to clarify for students that isn't the case. But it's really a known person that understands the university culture. It's a single point of contact. And that individual is available to support them Monday through Friday. So it really is that point of contact. I hope that answers, it's moved off. So I hope that answers your question, Chris. If not, just happy to clarify. How does your work affect U of T policy? Yeah, that's a really important question. When we started engaging the U of T community and developing Inlight, every conversation went back to the very recent, at that time, what was called the mandatory leave policy, which related to if students were in a clinical position where they were really unwell, they were hospitalized for a long period of time, or there were other reasons, although it's very specific on the policy. This policy would be utilized by the university. I should say after consultation with students, it has now been changed. The title of the policy has been changed to the compassionate leave policy. I do strongly believe, and I've had a lot of conversations with the vice provost students, as well as the provost, Cheryl Regier, that the engagement piece that Inlight is leading, it's a focused with resources engagement piece, is having, I would call, a trickle up impact on U of T policy. So we, our expertise is in student engagement and research, or in having students react to not necessarily policy, but react to how things impact them, specifically research. One thing that changed really early is our student engagement policy at Inlight talks about remuneration, that students need and ought to be remunerated for the time that they put into that they give of their expertise into task force or policy co-design. And so we're working closely to have policies updated where there is some remuneration, whether it be financial or other, for students. I think it's also that we're at the table in Light, and our leadership, and that we work to have student voice at some of these tables. It's complicated, as anybody who's been to U of T knows. U of T is extremely complicated because it's just so large, and there's the tri-campus piece. So I think we're also impacting policy through our research. So I can share, we fund a number of research initiatives I can put on in a moment that really would directly impact policy and also clinical decision makings in terms of pathways at U of T. Yeah, so Pam, that's a really good question. We do have peer support at U of T, and students are really proud of it. Inlight recently hosted a panel with the parliamentary secretary for the Ministry of Colleges and Universities, and Emma McCann, our engagement lead, who's a staff person with Inlight, put together a very strong committee of students, not just from our student advisory committee, but broadly from U of T, for the Minister Natalie Pierre, to connect with. And through that, it was really clear that the peer support model that's run out of health and wellness was having a positive impact on students. I should say this is something that is a strong interest of Inlight's to fund the research and evaluation of this model moving forward, but we do have peer supports, and I can find the link to that for you. I think Gloria posted our the overview of our meeting with the minister, but we do have peer supports. It is newer, the access and the breadth of it, including their peers are actually posted and available within the libraries at U of T. So I think one of the things that, no, I don't think, I know one of the things that the peer support, there was 3 members of the peer support team at this connection or this meeting that Inlight hosted for the Ministry of Colleges and Universities, was that it was clear that there's a lot of resources at U of T that many students as well as faculty and staff don't know exist. So one of the priorities of Inlight is to work with students on what's best practices in communication about student mental health resources and policies to students. I think that'll be another area that Inlight can support and lead and possibly impact policy decisions. Like, how do you communicate and how do we know students are aware of the resources that are available to them? Last question. I'm losing my voice. Sorry, I'm getting over a cold. How well does gender diversity, the student panel, match the gender diversity of U of T? That's a really important question, and it's something that we take very seriously. So I should say, and we have on our website the information about the call for students. We don't mandate students that are applying to our student advisory committee to disclose what their gender, sexuality, or even their reason for wanting to be on the student advisory committee, although many do. We have done an anonymous like demographics survey for both the Student Advisory Committee, but also everybody who's applying to our fellowships and our grants. And the purpose of that, Gordon, is to identify where we may be missing the boat. Where might we not have representation? But I am proud to say that based on what our Student Advisory Committee has shared with us, we are very diverse, both from a race background, cultural background, and also gender. But we always have work we can do. So it's a priority of leadership, as well as our engagement lead, to ensure that we're always reviewing this and ensuring we potentially hold specific spots on our Student Advisory Committee for representation of groups that perhaps we aren't able to engage through our general call for applications. I hope that answers your question. And Anna, I see you have a hand raised. I don't think we're able to do audio on a webinar. I'm looking to Gloria for that. If you could type it in the box, or maybe it was just a hand. Oh, we can do audio. If you have an audio question, we can, Gloria can give you audio. Anna, if you still have your question, you should be able to talk. Oh, yeah. Okay. Just if she's asking, what I will do is I do want to share both my contact information. Am I sharing screen, Gloria? I don't think so. Sorry. Doing this weird thing, not sharing screen. Thank you. There we go. So my contact information is here, and I can put it in the, but feel free to send an email. Also, we have an email. Gloria, do you mind putting it in the chat function for Inlight? And our engagement lead, Emma, she's on vacation this week, but she tends to respond, or myself or Gloria. We always respond. It just tends to be Emma. Feel free to shoot me an email. The other thing I wanted to just highlight was many of the questions that were just asked, we are actually funding through Inlight funds. So we have some research funds that we give out. So for our fellowships, really a strong focus on diversity in the fellowships that we've funded, and student experience, as well as our research grants. So you'll see we have quite a number across the 3 divisions, and as well strong representation on or focus on diversity in the student experience. And again, these are announced on our website, so feel free to reach out there. So I guess Anna didn't have a question. That's okay. So I think I'll wrap up there. I don't know, Iber, if you wanted to come on.
Yeah, thank you so much, Kristin. Really, really appreciate you making time to speak to our alumni today. And I think everyone present will agree that, this is an incredibly important and timely conversation. And you've certainly left us with a lot of resources, even though I mentioned in the beginning, these talks have no homework. But I think this is wonderful information that everyone can benefit from becoming familiar with. So thank you again. For all the great work that you're doing in spearheading this initiative. Thank you to everyone who took the time to attend. Again, congratulations on another alumni reunion week, and I hope you make time for other activities. We have a week full of social events, opportunities to learn what's happening at the university, and I hope you'll join us for some of those. Have a great rest of the day and a great evening. Thanks, everyone.
Thank you.